los temas de seguridad y migración.
Algunos de los énfasis de la relación México-Estados Unidos.
Democracia, lucha contra la corrupción y derechos humanos.
Protección humanitaria frente a la migración.
El sentido de frontera de Estados Unidos.
La cuarta parte de los inmigrantes en Estados Unidos son de origen mexicano.
Baby, I don't care, 'cause your love's got the best of me, and baby, you're making a fool of me. You got me sprung and I don't care who sees, 'cause baby, you got me so crazy. Ooh, yeah, yeah, yeah. You got me crazy. Whoa, oh, 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 no, no. Whoa, oh, 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 no, no. Whoa, oh, 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 no, no. Whoa, oh, oh, crazy in love.
I have climbed highest mountain, I have run through the fields, only to be with you, only to be with you. I have run, I have crawled, I have scaled these city walls, only to be with you. But I still haven't found what I'm looking for. But I still haven't found.
Hola, hola.
Hello.
¿Cómo estás?
Bien,
Gusto en
vamos
saludarte.
a empezar. Voy a introducir
Ok.
a todo el mundo. Espera un
Muy
momento.
bien.
Welcome back to the third panel of the day. A couple of housekeeping points. If you've got questions, there's a Q&A. The chat function is if you have comments. But if you have questions, go for the Q&A, and we'll do our best to make sure that those get to be part of the conversation on the panel. Also, as far as social media goes, we have our hashtags. Hashtag reporting the border, reportando la frontera, all one word, or IU_UNAM21. Well, let's get started. I want to introduce our moderator for this round. It's Aspel Guzman. She's a documentary filmmaker focusing on international migration. In 2018, she earned 5 nominations as a Crystal Screen finalist for reporting on international migration. She's also won the State Prize of Journalism in Michoacan in 1998, prize of the Ibero-American Association of Regional Related Television in 1998 for the Best Television Report. She's participated in working meetings on international migration organized by the Center for Migration Studies of the Michoacana University of San Nicolás de Hidalgo. She is an advisor and a producer in political communication, and she is also our amazing moderator for the third panel. Welcome, Aspel.
¿Qué tal? Mucho gusto.
How are you doing? Nice to meet you all. Nice to be taking part with you. It's an honor.
Pues, ¿Me escuchan? Perdón.
Can you hear me there? Yes. Okay, my apologies. No, you're welcome.
Yes.
How are you? Good afternoon, everyone. Well, we know that right now we are part of the pandemic. And well, after this situation, we faced many, many challenges in terms of political and health and social, financial matters. environmental worldwide. And I do agree with the fact that this health crisis has also shown a lot of and brought a lot of inequalities in many parts of the world. And of course, we know that this has happened in Latin America as well. And this is exactly during these circumstances where the most vulnerable populations, such as migrants, those who have been displaced, refugees, they just become the most affected groups, according to the evaluation made by Antonio Herrera Vitorino from the International Organization for Migration. In 2020, the situation for migrants in the world got worse because migrants are precisely those persons that you don't think about specifically when they are in these circumstances. So for that reason, there is a need to really just start talking and addressing several questions. For instance, what happened with those migrants that just stayed there, just somehow strayed because the borders were closed, or those who have lost their jobs because of these health restrictions, or what happens with those migrants who, facing this reality, do not have the financial capacity to get this primary care or preventive care for health purposes. And I also believe that it is important to think about the situation of vulnerability of boys, girls who are unaccompanied, and those families who were separated, who are now just waiting to be reunited because, well, they were just separated because of the pandemic. And also, we need to start thinking about what happened with migrants who are just waiting to get their migration situation up to date and legal. We also need to analyze the potential pandemic situation, the physical, sexual harm for migrant women, and those cases of work and labor exploitation. We also see this overlook in the situation with what happened. What happens with this? What has happened with shelters, with migrants, specifically when they are in the border of Mexico, and how these circumstances start to occur, specifically for those who have been deported or those who are in transit. And well, we have just implemented all of these actions in the United States. So this has been very, very, very complex to start just really thinking and being aware and trying to work from different arenas and with different tools. And I am also positive that this is the time to really start discussing and to recognize the great contributions by migrant populations at their place of destination all over the world. So without further ado, I would like to welcome you all to this third panel today, Global Trends of Migration and Human Mobility in the Context of the Pandemic. And I have the honor to introduce our first speaker. He is Tomás Milton. He holds a degree in communication and journalism. He holds a master in international relations, and he has a PhD in political science by the National Autonomous University of Mexico. He's a professor and researcher adscribed to the School of Political and Social Sciences of the UNAM. He is a guest professor of the Instituto Tecnológico de Estudios Superiores Monterrey in the Puebla campus. He is also a teacher for the master's degree on migration studies of the Universidad Iberoamericana, and he's also a column journalist at the journal El Popular de Puebla, and he's also the head of the International Relations magazine of UNAM. So be welcome, Doctor.
In this great event. Primer término, debo de agradecer obviamente.
First and foremost, I would like to thank the organizers and to all of you who are just following this broadcast, and as well, thank you so much. And well, as you mentioned, migration has affected human mobility over the past 13 months. I would like to address some of the subjects that our moderator has stated, I would just like to make a clarification, my dear, as well. I have 5 minutes or 20? I don't know. 20. Okay, great. I'll stick to my time. My lecture is based on 3 pillars. First, what has happened with migrants in Mesoamerica and in the North American corridor, and some other non-tangible elements based on the positions of state and other local media. And number 3, I will now address very specific situations that are being faced by migrants. And lastly, I would like to finish just with some proposals and just to really readdress these situations and what happens in the US. And if I may, you know that, well, as of March 2020, that's when the WHO declared that COVID-19 was a pandemic. Then, of course, we know that these dynamics had to face some consequences as well. And also, well, one of the most tangible impact that we have seen, not only in Latin America, but also all over the world, is a full shutdown that we had with human mobility. Well, the situation was like that. Well, we had a full shutdown in China and some other points as well that were deemed to be some milestones for human mobility, such as Shenzhen, and in some points, let's say last year, what happened with the border in the US and Mexico? Well, we had some shutdowns that had to prevent, let's say, non-essential passage. We were addressing tourism that has impacted on mobility, more particularly in terms of migration. You must remember that also we had a distribution also in terms of, let's say, in-transit corridors, such as the Mesoamerican corridor, that is mainly made up of Mexico and the US. But by half of the year, regardless of the pandemic, and also with the points that we had, well, organized crime, violence, and hurricanes that also hit Central America, all of this, this is what really had an impact on this immigration flow. Over the past month, we have noticed a higher increase or reactivation, but not even this pandemic was able to somehow hold back this migration. We know that, well, migrants, specifically those who are undocumented, they have been retained in the US, in Mexico, under, let's say, crowding situation, without the proper protection facing COVID-19, not even, I mean, to say the least, masks or antibacterial gel in Mexico and the US. In the US, we know that we keep and kept and will continue to keep deportations to our country and to Central American countries without taking these actions just to prevent the spread of this virus. We had, let's say, some sudden deportations that did not follow the protocol, and this has been proven by some journalistic works. And we had some populations who were just like this in the US. Accordingly, as you may see, well, undocumented migrants who are in the US, they came to be one of the most vulnerable populations in the US. The mortality rate in the Latin community is the highest in terms of this virus. Vaccination indexes and rates are way below from those of, let's say, of the white population. And just, let's say, to January 2021, in the northern country, over 3,000 Mexicans had died. We know that as part of this, let's say, situation, this landscape and what is going on, also specifically with this ACNUR and International Migration Organization, they did not have enough resources to continue with their standard activities. And last year, we were not under a regular or usual year. To just address, and this did not happen. And despite all of this, what happened is that we were able to prove the worth, the value of immigrant workers in Europe, in North America, in many parts of the world, in what sectors, agriculture, which was key, services as well. And even in the US, even if we had such a terrible character who is a xenophobic, Trump, well, they stopped these H-2A visas, and these are specifically for those persons. And in Italy and Portugal, they even had some legalization programs to help these migrants who are devoted to agriculture. Why? Because they are essential. And we also need to address other situations. For instance, if we need to think about the rhetorical about some states and some stakeholders, first and foremost, they reinforce this safety argument that the different states had. Well, they knew that undocumented persons are not terrorists, but they just stated that they were a health risk. And let me tell you that undocumented migrants, they do not have higher rates of, let's say, diseases than those migrants who are consistently just traveling over and over. And also, over these past 13, 14 months, migrants have been criminalized, basically as if they were the ones who carried this virus. Xenophobic actions in the US against Asians, they have been blamed for spreading the virus. That is just a myth. That is a lie. And also, we need to emphasize on what is going on with the media, traditional media, and also those media hubs that are now online and also found in the social media. We also see some cases where we criminalize migrants. Well, an example is Fox News. It used to be the favorite broadcast of Donald Trump, where they were just broadcasting this type of, let's say, situation. They were just showing or portraying images of invasions to, let's say, American territories of immigrants that were not even from, let's say, the US. Do you remember Breitbart News? This is a media hub that is found in the media online, that it's from the left wing, and this was run by Stephen Baldwin, who is just a point as well, and migrants as well, who were part of the enemy of the US. We also have these situations that were not really good in terms of some media hubs, traditional, non-traditional ones, and well, I cannot tell you enough that we need to stop just using the word illegal. No human being is illegal. We need to stop just criminalizing immigrants through the media, whether intentionally or just out of ignorance. From the media, we need to understand that no one is an illegal person. No human being is an illegal person. And also, early this year, well, we also were working with caravans that came from Central America on Facebook. And we also had some fake images that were just outside stadiums in Querétaro, where we have a lot of trash, and immigrants were blamed. And well, we have Lady Beans. She was a lady who just simply said, you know what, I'm tired just of eating beans. And we Mexicans were just really mocking her. So also, what has happened? I mean, how this pandemic just also affected this disease? Some people live in overcrowded places as well. And also, we know that they cannot be at home because they were destroyed. They were removed of these types of subsidies and at home in their own medicines and drugs. In the case of Mexico, we got over 40 billion USD in 2020. However, I am telling you that this is not the achievement of any government. No, on the contrary, these are the efforts of our Mexican migrants who are just submitting their remittances to their families. They are just really working. And lastly, I would like to tell you, well, what are the challenges facing the US? What are the differences that we have as well with this vaccination indexes? Well, in rates, what happens in terms of the while you do these three governments, Mexico, Canada, and the US, they know that the quicker their populations are vaccinated, the more we will have to wait until we have this financial recovery. For that reason, it is important as well to tell what the population, all populations, including those populations that are undocumented, to have access as quickly as possible to these vaccines. And of course, governments are also very concerned about the economy. Otherwise, we are going to be just really be somehow surpassed by this commerce in China and their agreements, the European Union, and so on and so forth. So what does this lack of cooperation entail specifically for vaccination purposes? That, well, maybe the economy in the region is going to take longer, and also that we may see some uncoordinated efforts. And, well, we're going to work with these elements that are required also in what we're doing. And, well, we're not, let's say, following the same pace in these production plans. And just to summarize, and also this inter-American process that was guided by, let's say, even Donald Trump did not like this NAFTA name. This was, well, we now have just substituted for what it is called as a TMEC now. And, well, we will continue not to recover from that. So accordingly, we know that migration is going to create more chances in this, what we call UMSCA in English. And, well, these are some undesired, unexpected situation. And whenever we think that migrants are the enemy and their worth is not recognized. So once again, I would like to thank you for giving me the chance to just address these words to you, and I will be just waiting for your questions or comments. Thank you so much for your presentation, Dr. Milton. Honestly, you have just shared a very complex outlook, and that invites us to just start just analyzing and just reflecting on what has been going on. Right now, we would like to pass the floor to our next speaker. She is Daffodil Alton. She's a journalist, a producer that was nominated to Emmy. She recently produced, ran, and was the correspondent for Frontline, Kids Caught in the Crackdown in 2019, and Trafficked in America 2018. Kids Caught in the Crackdown also was awarded an Emmy for the consistent and continuous coverage. And she also produced the Frontline Univision that was nominated to Emmy, Rape on the Night Shift in 2015. Hopefully I did not mispronounce it. That led to a legislation amendment in California, Oregon, and Washington. And then she also has the fact that she was a producer of a research report for the School of Journalism at UC Berkeley, and she's also a producer in the Reveal Research Report Center. She has produced and written for MSNBC, Telemundo, QQED, Reveal, PBS NewsHour, Univision, Los Angeles Times, Mother Jones, and the Associated Press, as well as OC Weekly, where she worked as a writer. She has been awarded for her investigative reporters and editors' work, Society of Professional Journalists, the Third Coast Audio Festival, the San Francisco International Film Festival, the Angeles Press Club, and Imagine Foundation. She has been nominated 4 times to the National Emmy, and she was a finalist in 2019 for the Goldsmith Award for investigation reports.
Voy a hablar mi presentación en inglés, pero a veces me meto.
I will just give my presentation in English, but I would like to speak sometimes in Spanish. So for interpreters, I'm going to warn you that I'm going to be speaking in both languages. So Doctor, thank you so much for your presentation. I think that all of this is connected as well. And the work that I do as a journalist leads me to think about, finding these stress points to just make them visible and to just share the stories that we tell.
I was just saying, I find myself at the crossroads. We are, at the end of the day, we are storytellers, and we're trying to tell these stories as accurately, as truthfully as possible, because there is so much that is happening. And so what we try to do is distill and convey. And it's been a challenging time over the last 4 years because our work as journalists has been challenged over and over by the previous administration of Donald Trump. So we've had to combat what our ethics are, what our standards are. We've had to really put that out there to remind people that we aren't doing this work without standards and practices, without ethics, without a search for the truth. When it comes to reporting on migration and immigration, I now work at Frontline PBS. I've been doing Frontline PBS films for the last 8 years or so. And the focus of my films has been on essentially, I think one of the panelists was saying in the last session, there's a lot of focus on the transition or what happens right when you arrive. And I would say, if I had to distill my work over the last, 2 decades, when it comes to migration and immigration, it's really what is the ongoing exploitation? Because once you get to the U.S., it doesn't necessarily end, especially if you're criminalized as an undocumented immigrant. And so what we've looked at in my prior work, is really the labor trafficking film was, yes, it was about Guatemalan migrant boys, but really it was about how they were exploited here when they were forced to work against their will on an egg farm that was producing eggs for dozens of retailers. And so really it was looking at what is the ongoing exploitation, and what does it mean to have rights as a worker, but not have rights as a citizen or have a work permit, so that you don't necessarily speak up when you're being exploited. You don't necessarily know that you have rights as a worker when you're simultaneously being given the message that you are a criminal if you are undocumented. So what happened with COVID-19 when that moment struck is, because I'd been doing this work for years, sources started reaching out to us. And frankly, I've been reporting on essential workers for a lot of my career. And so you had the situation where all of a sudden, so many service workers, agricultural workers, farm workers, meatpacking workers, airport workers, janitors, they were working in hospitals, airports, meatpacking plants. And we started hearing from our sources saying, okay, we've been deemed essential, critical to the nation's infrastructure, critical to the nation's food supply, but we don't have protection. We don't have anything. We're scared. They're giving masks to the stewardesses, but we, the janitors, we don't have anything. And so we started thinking about, we have to do something about what we essentially at the end for the film called COVID's hidden toll. Because what was getting a lot of attention at the time was the toll that the virus was taking on the essential healthcare workers, which of course, that was very much a real story, but we also wanted to cover and pay attention to the story of the workers who were also deemed essential, who had no protection and who were high risk for infection because of different health issues, because of their immigration status, because of living conditions. And so we decided to focus on agricultural and farm workers because of the difficulty also of getting into hospitals and places to shoot. I'm a filmmaker, so we have to go in with equipment. There were no protocols at the time. This was exactly a year ago in March. California was shut down. I couldn't fly anywhere. So it was a very challenging scenario, but we also knew that this story was unfolding and happening as we spoke. And so we had to think about the other thing that was going on simultaneously was There were infections in the detention centers, and detained migrants were being treated the same as, people who were incarcerated. And so there was a whole crisis there in the detention centers. And so because our focus has been on workers, and because we also understand that migration, it doesn't necessarily, you land somewhere, and most farm workers are longtime residents of the states that they live in, but they move around different states to work, but they've been paying taxes and they've been somewhere for decades sometimes. And so this sense of, what are you? And you're not actually an American, you're not actually here. Well, most of them are longtime residents of the states, and they want those rights, they want that protection, and they weren't getting it. And so what we were finding was a real tension between having to go out and risk your life because you had to, because you were essential, and wanting to stay home and protect yourself and protect your family. And so what we did is we told the story. What we do is we try to find people, characters to tell the story through. And I will say it's very important. It really does matter who is doing the storytelling. And I think it matters that my family is a family of immigrants. And it matters that I am the daughter of immigrants, and I have that very specific perspective, so that you really have to be careful when you tell these stories, so that you're not just giving a victim narrative that is patronizing in the way that that you portray the people who are going through this, because these are real people with agency. And so we really spoke to dozens of farm workers and meatpacking workers, and most of them didn't want to go on camera. Some of them agreed, but then we really found a few people who were driven and needed to speak, and really had a lot of agency. And I think the nuance there, and our ability to understand that and look for that as a production team made up of all, multilingual people of color primarily, that I think really adds to the nuance of who it is that we feature in our film, how people are able to have their own agency in their storytelling. And so even though I'm the correspondent for the film, it was really driven by one of the central characters, Cynthia Hernandez, who you will meet here in a clip that I am going to show you. And then I'll talk a little bit more about the film's evolution. Can we play clip 1?
Sí, lo que es mi salud, no toco el tema con nadie. Yo tengo células cancerosas. Pero en estos momentos nos hace trabajar más la necesidad que el mismo miedo que tenemos. ¿Ya viene, vecino? Sí. Pues le encargo, vecino, porque me tiene aquí en el frío. Ahí voy, falta de las 4. Y nos estamos titiriteando aquí de frío, vecino. Apúrese, por favor. Aquí vengo llegando, vecina. Acá viene pelos. Mira el niño, ¿qué te dije? Buenos días. Parecemos sardinas enlatadas en esa van. 15 personas que vamos. Ahí sí no hay que respetar tus 3 pies. Ahí es de que todos como buenos hermanos juntitos y bien apachurraditos. Yo sí soy una trabajadora esencial. ¿Por qué? Porque nosotros cosechamos la verdura que la mayoría de las personas en este país ocupan en su mesa. Nosotros salimos al campo, nos exponemos. No somos robots. No somos gente que porque trabajamos en el campo no nos vamos a contagiar. Nos vamos a contagiar.
So for us, that was Cynthia Hernandez.
Para nosotros fue
And she also had diabetes. So at the moment meeting her last year, she was somebody who was supporting, you don't meet here, but she had two disabled siblings, one who was quadriplegic. She had an elderly mother and she had two children, and she was the head of her household, and she's in her early 40s. So she was tremendous and very stressed out, but also very much understood that this was a crisis and that she had rights as a worker and that she wasn't getting the protection that she needed. So what we ended up exploring in the film through her story and other stories is the way that the government, both the state government and the federal government, opted not to institute mandatory workplace standards around COVID-19 when they could have done so. They could have done that for all essential workers when the lockdown orders were issued, when they issued the essential worker listings. I mean, there were all kinds of, there were certainly many opportunities when both the federal and the state government, I was in California, focused on California, but this was a national story, really could have done more to require employers to protect their workers. And we're talking about basic protections, requiring employers to, put in separators, to provide face masks, to inform employees if there was an infection at the work site. So we were finding in our reporting early on that what had been issued were guidelines that were voluntary, that employers could follow. And what this did is it really put workers in a situation where they couldn't speak up. They were afraid to speak up because they didn't want to get fired, but they were terrified of getting COVID-19. It was an awful situation to be in. And we'll play the other clip just because I'm running out of time, and I wanted you to see just sort of how we lay out the film, and then also who's in the film.
As millions of Americans were sheltering in place over the past months, we began looking at the toll the coronavirus was taking on those who cannot stay home. Agricultural workers, many of them undocumented, who were deemed essential to the nation's food supply. I've been reporting in this community for years, and as the annual harvest was starting in California this spring, I was hearing from workers who were daily having to choose between their jobs and their health.
Todos los campesinos estamos haciendo un sacrificio grande por necesidad. Sobre todo es por necesidad, por hambre, por ver a nuestra familia comer y por tener donde vivir.
Cynthia Hernandez is one of the few workers out of dozens we spoke to who agreed to go on camera. She's a broccoli picker in the Salinas Valley, a region in California that produces most of the country's leafy greens. In addition to having cancer, Cynthia has diabetes, both of which put her at high risk for complications if she contracts COVID-19.
¿No nos están dando lo esencial para protegernos? Mala, espérense.
She works for a contractor that supplies workers to farms in the area. She told me she's expected to bring her own mask to work.
Nosotros que estamos trabajando y tenemos tantas deudas y cuentas que pagar, el dinero a veces no nos alcanza ni para comprar una sola mascarilla, que en la tienda no lo dan. Una sola mascarilla, $3, $4. Y es desechable.
When we met Cynthia in April, there were no required COVID protections for farm workers, beyond general rules about masks and social distancing. Even now, companies don't have to tell workers about outbreaks.
Quiero tomarme hasta un ibuprofeno. Me duele mi garganta.
If one farm worker gets sick, you're going to get a crew, which is typically 30 people, sick. And if each of those people goes out, they're going to get 3 to 4 other people, because that's the infection rate. And so the thing snowballs.
Good morning. Good morning.
Dr. Max Cuevas runs a network of clinics in the Salinas Valley that primarily serves farm workers.
And so with my staff, I told them we need to plan with whatever little resources we have. We need to plan to make sure that those resources are in fact available. So we thought, let's jump in. Let's begin making masks.
Just before dawn, Dr. Cuevas' team was meeting workers as they caught rides to the fields.
Buenos días. Somos de la Clínica de Salud. Estamos regalando máscaras. ¿Le gustaría? Ok. ¿Va a venir más gente? Somos de la Clínica de Salud. Estamos dando máscaras. ¿Le gustaría una? ¿Le gustan máscaras? Estamos regalando máscaras. Una para ti, una para tu esposo. Máscaras. ¿Quieren máscara?
When our state and federal governments announced that the farm worker was a part of the essential workforce, included with healthcare, first responders, police, it's not your middle class essential worker that people are talking about. This essential worker, a lot of them do in fact live in fear. They don't want people to know that they're here undocumented. There's that fear of, I could be gone tomorrow if I'm taken away, and what's going to happen to my family. It's a horrible kind of fear that people learn to live with. You try to assure them that don't be afraid of that one right now, be afraid of the virus.
Great. So I will end on, so Dr. Cuevas's point, I think, is what's so central to a lot of the work that we're doing, which is the fear of deportation because you're not legitimized here. When I say the migration hasn't ended, it's because you can't land and begin if you're in a constant state of potentially being returned, your life being uprooted, everything that you have being taken away. And so that perpetual state of that perpetual fear, it's the elephant in the room here in the US, because the majority of agricultural workers, farm workers especially, the processing plant workers also are undocumented. And so what that does is it opens up for so much exploitation, so much abuse, labor trafficking, sexual assault, withholding pay, and then we saw in the COVID situation was not having protection, worker protection. And as you learn in the film, when Cynthia finds out there's somebody infected on her crew, we meet another family, and there's an infection there, and multiple people in the family get infected. What you learn is that everyone is holding everything inside and trying to protect themselves, but they're not reaching out for services or speaking up about violations of the workplace because they are implicitly always being told that because they're undocumented, they have criminal status. And so I think that's something that we need to be thinking about in terms of what's at the heart of all these stories is the fact that you perpetuate this liminal state, this liminal status where you cannot fully participate and engage as a citizen of the country because you're being kept in this corner where you're being criminalized. So I'll leave it there and then we can continue later with Q&A. Thank you.
Muchas gracias, Daffodil, por compartirnos parte de tu trabajo.
Thank you so much for just doing all of this. And this has been a very tough situation. And I believe that our work, the work that we do, is very, very important just to make these stories very visible. And more particularly with migrants who are under this irregular situation. So thank you so much. If you're following us, I just wanted to tell you that you can just ask as many questions as you'd like to our speakers through the chat box. And once we are over, we're going to have more time to interact, to learn more about the research that you are conducting, the projects, and many more things. So now let's just continue with our third speaker, Robert Warren, and he was a demographist. He was working in the census office. And we have immigration. He was also the head of IMS from 1995 And part of what he did as part of immigration, he just was sharing this unauthorized ranks and numbers of immigrants under the control law, and according to the immigration law in 1986. And he has testified before the Congress on the estimation of undocumented immigration. He was a witness, an expert witness for the Department of Justice on the subject of education for undocumented children, and he was also a representative in the UN on immigration statistics in Geneva in May 1986 and February 1991. Robert, please go ahead.
Thank you. And also I'd like to thank the organizers, although it worries me a little bit that they made me last on the entire program. You could either interpret it as they saved the best for the last, or maybe we'll put him here and no one will notice. I'm not sure which, but thank you for inviting me. I've had a long association with Indiana University. I finished my master's degree there in 1969. That's right, that you heard the right number, 1969. And from there, I went to the Census Bureau and started my career. And about 7 or 8 years ago, I was working with the Center for Migration Studies, and we developed some really good data on undocumented immigration. And I'll tell you about that at the end of my presentation here. But when we needed someone to do a web tool for us to show that data, we turned to Indiana University. And they created, I think, a really fabulous data tool. I'm going to do two things today. I'm going to show you some pictures and photos. I'm going to give you some graphs that show trends in US immigration. And at the end of the presentation, I'm going to show you the web tool that I mentioned. And I think you will be, maybe the word astonished is too strong, but you'll be surprised at how much information we actually have about this population now. Before I begin, I want to give a tribute to Dr. Jorge Bustamante that I was fortunate enough to work with in the 1980s. He was truly a gentleman as well as a scholar. And if you don't know about Jorge Bustamante, I would recommend that you find out about him. Now, all of the numbers that I'll discuss today were derived from the American Community Survey that the Census Bureau runs every year. It's a large, detailed household survey that's done every year, and they survey 3 million households. So that's a very large survey. And I'm going to have a PowerPoint presentation today. This first, the picture that's on the screen is not from January 6th. It's a happier time right at the beginning of the administration. So let's go ahead and look at the next slide. This slide shows the size of the undocumented population. Before I start, let me say I'm not sure if I'm actually in the right session or not. It seemed like from looking at the agenda, maybe I should have been in the first session. And the people I work for, the Center for Migration Studies, we've only put out one report on anything having to do with the pandemic. And it was a report on essential workers. And essentially it showed that undocumented essential workers, that they had a higher percentage of people working than legal immigrants, and also a considerably higher percentage working than native-born workers. So I wanted to throw that in just to make sure that I was in the right session. So going back to the graph, to the PowerPoint, please. Okay, this graph shows the size of the US undocumented population. You see in 2010, the number was about 11.7 million. and it drops almost steadily throughout the decade. You might have noticed in the media that for a long time they talked about 12 million, and then they've kind of gotten used to talking about 11 million. They haven't yet caught on to the fact that it's getting closer to 10 million. And by the way, I don't think, I'm afraid legalization might not pass because of the Republicans in the Senate, but if it were to, and someone would ask me, how many do you think would come forward? I would say about 7 million. And the reason I say 7 million rather than 10 million is that in past legalization programs, roughly 2/3 have come forward. And there are a lot of reasons why people don't, and I'm not going to go into that right now. So essentially, we see that the population dropped by about 1.4 million from 2010 to 2019. And the next slide shows why that happened. The dark line shows the undocumented population from Mexico. And you see that in 2010, it was 6.6 million. By 2019, it had fallen to 4.7 million. That's a drop of about 1.9 million over a 10-year period. That's one of the biggest unreported facts about undocumented immigration. There are 2 or 3 other bigger unreported facts, but I'll get to those later. The undocumented population from all other countries, other than Mexico, increased by about 500,000 from 2010 to 2019. So the undocumented population from Mexico dropped faster than the rest of the population increased. And that's why the total population declined by about 1.4 million throughout the decade. And now we're going to take a closer look at undocumented immigration from Mexico, and it'll show you why that line dropped off so much in that 10-year period. So the next slide is, it looks very elaborate when you first look at it, but I think it'll make sense soon, I hope. The orange bars are the number that moved to the US from Mexico, undocumented immigrants arriving each of those years. And you'll see that it was about 125 or 30,000 early in the decade, went up a little bit, went back down a little bit. It was on average around 140,000 every year. And these numbers have not been, they've not been smoothed statistically. Those are the numbers that we estimate arrived and established residents in the US every year. Now the green bars are the number that left every year. And your first reaction might be, how could more people leave than arrived? Well, the green bars are the number who left the entire population. So the 385,000 number for the first green bar, that's how many of the entire population left that year. And you'll see that in the first couple of years of the decade, about 385,000, 375,000 were leaving the undocumented population each year. Now, the next 2 years were like 160 and 170. Now, there's a very important principle involved here that that's important for current discussions of legalization programs. The people who want to restrict immigration make the argument that if you even talk about a legalization program, or in this case, in 2013, 2014, legalization actually passed the Senate, but it didn't pass the House of Representatives. Their argument is this: if you even talk about it, people will come rushing into the country to take advantage of it. Well, if you look at the orange bars, clearly that did not happen. There was no upsurge, or whatever kind of crazy word they want to use. But what happened was fewer people left the undocumented population. That is, they stayed around and waited to see what might happen. And legalization failed. And you see the number went back to 395,000 in 2014 to 2015. And then it stayed there. And then you may remember around 2016, the US got a new president with very harsh, that's kind of a kind word, but that's the word I'll use. Very harsh immigration policies. And you'll see that the numbers leaving the country went up considerably. That in 2 of the years there, more than 500,000 people left the undocumented population. Now, not all of these people are, not everyone on this graph who left are voluntarily moving back to Mexico, although the majority of them are. A few of them die because they're, only a few because they're at young ages. Some percentage are sent back to Mexico by DHS. Some of them get a green card, and so they leave the undocumented population. But the pattern shown here is of return migration to Mexico, and that the size of the green bars is the reason that the undocumented population from Mexico dropped by 1.9 million during the last decade. Now, the next graph, we have a little bit broader view of undocumented migration from Mexico. And the blue line, this graph goes from 1995 to 2016. The blue line is the number that arrived from Mexico. And you see the number peaked at 785,000 in the year 2000. And then it dropped dramatically. And I mean, dramatically is the right word, because the number coming in dropped from 785,000. In the next 10 years, it dropped to 130,000. That's a drop of 80% in 10 years. That should have been headline news all over the country, but it wasn't. And furthermore, after the number dropped to about 130,000, as you saw in the previous slide, it stayed at around 130 or 40,000 right on up to the present time. So the number dropped very dramatically. The other thing shown in this graph, the orange line, is the number who still lived here in an undocumented status in 2016. So for example, of the 785,000 who came in the year 2000, only 325,000 were still living here undocumented. That is, they had either gone home or they had gotten legal status, one way or the other. So you see, I think this is a very significant graph, and I think the fact that undocumented migration dropped by 80% and stayed there is a very important statistic that should be reported much more widely. I have one more graph on this. The next graph shows how people arrive in the U.S. It shows how undocumented immigrants arrive to the U.S. And in this case, the black line represents people who overstay temporary visas. They're mostly people who overstay tourist visas. And you see that the number back in 2005 was around 310,000. And it increased somewhat, not a lot. It went up to 385,000 by 2016. So that's the number who come in and overstay their visas. The number of border crossers was about 500,000 back in 2005, and we saw that in the last graph. It was on the huge decline, and the number of border crossers dropped so much by 2009 and 2010 that the number was well below the number who come in as and overstay their visa. So in the past 10 years, the number coming to the US, the number of undocumented arriving in the US, we've had twice as many visa overstays as border crossers. The people who hand out immigrant visas abroad are in the State Department. And the first budget that President Trump put forward cut the State Department by 25%. That's just a little possibly irrelevant, maybe not fact, as I thought you should know. Now, that's kind of my summary of the trends in undocumented immigration. One of the things you might have noticed is that we do know a lot about undocumented migration to the US, and that's because about 7 or 8 years ago, we made a breakthrough in being able to estimate the numbers. And I'm going to show that to you in the next slide. The next slide, I've sort of gotten the idea that maybe doing PowerPoint presentations is not the thing to do anymore, but that's okay. I did it anyway. But and the other thing about this slide is if you're going to do PowerPoint presentations, you probably shouldn't just put a whole lot of numbers on there, and so it's kind of, they all jumble together. But I did that too. And the reason I did that is because I think you'll find that there are some amazing statistics in this table. And after this slide, I'm going to show you how you can get all of this information, any of this information you want and more at a website. And that website will allow you to get information about the entire US or any state in the US or any combination of states. But that's what I'll do next after. I just want to go through. These numbers are for the entire US undocumented population as of July 2019. So there's the 10.3 million is the total. And you see that the top 5 countries are Mexico, El Salvador, India, Guatemala, and Honduras, with Mexico being the largest. 58% of the population has been in the country for 10 years or more. With the number arriving going down so much, more and more people have been here longer. 46% are female. The population that's 18 to 64, the most working age population, 89% of our undocumented population are in that age group. 70% speak Spanish at home. 59%, almost 60% speak English well, very well, or only English. Now, the next one is one that may surprise a lot of people. The percentage of the total US undocumented population that have gone to college or have a bachelor's degree or higher is 1/3. 1/3 of the population has gone to college or have a degree. 4% are married to US citizens. And you might ask, well, if they're married to US citizens, why don't they get a green card? And that's kind of complicated, and I kind of wish I hadn't brought it up. But as you may know, if you entered without inspection, you're not allowed to adjust status no matter what. I see that I'm kind of running short on time. I'm going to let you look at this maybe on the recording, but I have to mention this website on the next slide. And in the upper left-hand corner is the web address, and I request that you please don't go to that right now. I've lost audiences before because they go to this and immediately start looking at the numbers. I just want to say that this was organized by the Indiana Business Research Center. And when you open this website, you see the map of the United States. If you click on, if you don't do anything and you just scroll down, you'll get all the information that I just showed you on the previous slide. And more. There's more information involved than that. If you click on a state, for example, California, it will turn blue. And when you scroll down, you will get all that information just for California. Now, if you, for example, you would like to know, well, how many people live along the US the Mexico border? You make California, New Mexico, Arizona, and Texas, you make all of them blue. And this website will add all that together. And when you scroll down, you'll get information for all of those states added together. It's really an amazing website. And the folks at IU just did a fabulous job of creating this website. I think with that, I probably will just stop and answer questions. Thank you.
Muchas gracias, Robert, por tu participación.
Thank you so much, Robert, for your participation. Thank you also, Daffodil and Dr. Milton. I believe this is a very complete outlook and complex as well. We have been able to understand the impact of migration during this particular period, particularly the immigration of undocumented people. I understand this is a very complex problem, which we will not be able to talk about entirely. However, I have a few questions. First, for Dr. Warren, why is it important to carry out this sort of statistics? How difficult is it to obtain real numbers? Because I understand that when people in these conditions are researched, they are very afraid to share the situation in which they are. That would be my first question. And the second one would be, what use can we give to all this information? And maybe a third one, why are these numbers not known, especially when these migratory numbers go down? Why is there this idea that immigration is ever increasing?
Wow, that's a lot of questions. I'll do what I can. Why? I'll tell you why this is important. Imagine that you have to go through 3 large doors before you can get the attention of the American people in terms of maybe making better policies. And the 3 big doors that you have to go through are, first, is a door that says the number of undocumented immigrants is huge and it's growing. Okay, you have to convince people that that's not true. If you get past that, then you come to this other door that might say, well, these are bad people. Well, obviously they're not. You have to get past that. I'm just talking about the conditions in the US. If you get past those 2 doors, then you have to say, you have to get past the statement that, oh, they have a negative impact. Well, they don't. So if you don't do those things, no one will ever listen to you. And so it doesn't matter how emotional you are, how wonderful work you're doing. If you don't get the support of the American people, nothing will ever change. And it might not ever change anyway because of politics. But so the answer is you have to keep doing this, even though, I mean, I've spent 40, 50 years combating made up numbers. The Trump phenomenon of making up numbers is something that's been going on with undocumented immigration for 4 decades. So it's important to get good numbers. And I'm sorry, I've forgotten other aspects of your question.
Sí, porque era.
Yes, I believe that was my last question, actually. Why do we always have that feeling that immigration is ever growing? What has to do with that?
Well, actually, that really gets to the heart of this conference. It has to do with reporting. And I'm not sure that I know the answer to that, although I know that this information that I've given you has been available for at least 5 or 6 years. The organization I work with the Center for Migration Studies puts out at least 1 or 2 reports every year. We put out a press release. Nothing that I told you is new. All of it is from the last 5 or 6 years. I don't know why, to be honest with you, I don't know why. I mean, the fact that undocumented migration from Mexico dropped by 80% and didn't go back up again is just phenomenal news. And people who do reporting just have not dug into the numbers enough. That's my only guess.
Perfecto, muchas gracias, Dr.
Thank you so
Robert.
much, Dr. Robert. And I believe that would be a second question for you, Milton. You who work in journalism, I have seen many of your publications. What would you say about this? I must say there has always been a political use of numbers. It is always a benefit for presidents or candidates to present alarming numbers. We are living a dreading situation. Remember that in the world, there are over 270 million people who live in a country which is not their country of origin. That means that 3.3% of the population is migrant. But for electoral purposes, it is more successful to say we're living an invasion. And here is a more specific example. Certain types of immigration are very visible. For example, in the case of Buenos Aires, Argentina, for a moment, they accused, they told there was an invasion of Chinese immigrants because these people are usually put up small workshops, and the fact that they might take away jobs from Argentinians was mentioned. In the last few years, immigrants from Africa, particularly from Senegal, arrived in Argentina. They were not many, but since they sold their articles in the plazas, in the squares, the perception, public perception, we are full of African immigrants. So on the one hand, we have misinformation, and on the other hand, we have a political use of numbers. So I believe this is what we as journalists must address. We need to put out these numbers because politicians who should always use statistical information in order to carry out good public policies, they change the numbers. So it is important for the general public to know these numbers and to stop this stigmatization of immigrants.
Y por último,
Thank you so much, Milton. And finally, Daffodil, I'd like to ask you 2 questions. One, how do you report from the border under COVID conditions? Because although these undocumented immigrants are working without proper protection conditions against COVID-19, you as journalists, as recorders of these stories, how did you manage to produce these films you shared with us today? Your audio is off.
During that time, gracias. During that time, there were no protocols yet. We had to just consult public health experts. We had to just go with what we knew. Obviously, things have changed now, and more people are getting vaccinated, and it's different going out. But in that particular moment in time, we knew, for example, that what little information we had, we did know that being outside, that sunlight helped to deactivate the virus. So that's why a lot of the film is actually shot outside, because we didn't want to bring potential infection to any of the subjects who were in the film. We didn't want to risk infection, and we just didn't want to become spreaders because we were moving around to different subjects, different farms, different people. I mean, we were moving around. We would have been the problem. So we really shot about 80 or 90% of the film outside, and then we had to just have we did the masks, but then it turned out our masks were counterfeit because of the supply chain situation. So our masks weren't even, real N95s, and we just had to, there was a alcohol wipes shortage, so we were just scouring, getting wipes sent from Boston, where Frontline is based. We just got everything we could, and we gave everyone the option, if they wanted us not to go into their homes or to shoot from far, far away. Everyone had that choice. And then some people Cynthia got very comfortable, and our cameraman was also always getting too close because he's used to doing that creatively. And so even when she's going to get a COVID test, he's in the car with her, which was very risky to do at the time. We didn't know everything. And so, but they had the windows open, and nobody got COVID, and everything was okay. But, there were situations that were higher risk. The meatpacking plants, we interviewed workers who were positive. We interviewed workers who were just out of isolation, so they potentially were still infectious. So we just tried to keep distance and do what we could, but it was very stressful and not anything I would recommend. And I've had colleagues, other producers who have gotten COVID, while they've been in production. So but we really went with the data that we had at the time, and that was really just trying to be outside as much as possible, which is why we focused more on farm workers than we did the meat packing, but we couldn't get inside a plant, even though actually we tried, but they wouldn't let us in. Was there a second question? No me acuerdo la segunda pregunta.
Muchas gracias por compartirnos tu experiencia.
Thank you so much for sharing your experience. I was going to ask you about social media, but we have a question from our audience. He asks, why do the media don't have the stories of immigrants, and why do they only appear in certain notes as numbers, cold numbers, and not as human beings with great problems? How, like the syndrome of Ulysses? Who wants to answer the question? Well, this is exactly why numbers to us, the numbers are there, but we manage to know who they are. Our work is to know who is being affected by this problem and this situation. And for many of us, numbers don't exist.
How many agricultural workers were getting sick? All across the state, only one county started doing it. Nobody was prioritizing these essential workers to track the infection rate. No one, when we were doing sexual assault of farm working women and janitor women, we couldn't find any numbers. There were no numbers. So there's some self-reporting that happens, but there's other data that just isn't being gathered, or there are people who aren't willing to self-report. So our job is to try to get you to the people who are actually experiencing this, and then our best to get the whatever data we can, to try to give you a picture of what the story is. But it's really important to know who's experiencing the exploitation, and also to know them from place of their own agency.
No sé lo que sucede con los medios.
I don't know what happens with the media and immigrant stories in the United States, although I know Univision did something because they have a certain propagation of information towards Hispanic citizens. But Dr. Milton, what could you say about this? There is journalism which really shows the faces of people and not only numbers. In fact, for everyone in the audience, if they tell us that 500,000 people are crossing Mexico towards the United States, doesn't say much. That's the importance of the media, who will show you Julia or Raul, individual cases who have problems similar to yours, but of course maximized, and thus they have to leave their countries. It would be unfair to say that no media in Mexico puts a face on immigrants, but I repeat, research must go deeper, and we cannot just get one story. We have to understand that in order to make people more sensible towards these issues, we need data, we need hard numbers. But we also need to understand that this person crossing our country has a family, a face, and a life. Sure. Does anyone else have something to add? Yes, of course. Robert Warren, please.
Yes, I agree with everything that's been said. And I remembered, I think your first question, and I think your first question was, why would people respond to a survey and end up getting into this data set that we have if they're undocumented? And actually, there's a history, a strong history of undocumented immigrants doing that, because the Immigration Act of 1986, the big legalization that the last liberal Republican president, Ronald Reagan, had, 3 million people came forward. And it was well established at that time that there was no problem whatsoever. I mean, they just walked right into it was the INS at the time, walked right in and applied, and there were no problems. And also the Census Bureau and DHS, I think there's enough information that's sent out to everybody when they fall into these surveys. They convince people that, for example, there's something called Title 13 that makes it so that the census data is totally, no one is able to get their hands on the census data. It's totally confidential. And I think maybe the other factor is one that I'm just guessing about, is that if a surveyor comes around to interview you, if you refuse, that brings attention to you. And I'm just guessing about that, but I think that combination of things probably makes for a high response rate in this survey. And the Census Bureau does a lot of follow-up. They go back to the address over and over. And then after all that, we make an adjustment for undercount of about 10, 12% based on some research we've done. So we think we have a pretty complete picture. But again, it's what happens to individuals that's really the most important thing.
Muchas gracias. Thank you so much for your comments, Robert. And I would finally like to ask you all a question. Consumption habits after the pandemic, I mean consumption how important is it that these productions also use their time on their space to address different sectors of the population? How do you think this is lived in the United States and in Mexico? How does this new tendency affect the situation? Well, without a doubt, the way we consume information is different today. Electronic social media are much faster today to spread information. Unfortunately, sometimes false information. So us as consumers have the responsibility to make sure that this is true information and not to reproduce it. How could this social media work in our favor? I propose that those of you who know undocumented immigrants in the United States, tell them through social media that President Biden announced that since February, there will be no discrimination. There will be the regulation of all, regardless of their migratory state. And those who do not trust this because they know immigration authorities, please reach out to your consulate. They are working so that more Mexicans have access to the vaccine. I hope they can somehow receive this message instead of just putting pictures and memes of denigrating immigrants. Someone else? And any other comment? Well, we don't have any more questions. So I only have to add, really I'm really grateful for your time and your input, so we can have a better outlook of the situation we are currently living. Unfortunately, this doesn't end, but finally, it does provide more qualified information. So thank you so much to you all for participating in this seminar. It has been a pleasure for me to participate and be here with you. Thank you so much to the organizers. Thank you.
Thank you.
Thank you. Gracias.
Gracias.
Okay, thank you so much. That was a fantastic final round. So much to think about. It's hard to sort of sum it all up, but definitely a lot of food for thought. Thank you, Asbel, and thank you, Daffodil, and Robert and Tomas for a great final session. I'm going to change channels a little bit. I'm going to introduce my friend and colleague, Galen Clavio, who is going to give us a few final words before we close down for the day. Galen is the Director for Undergraduate Studies at Indiana University's Media School, and he also directs the National Sports Journalism Center. His research focuses on the impact of new and social media on interactions between consumers, media, and sports entities. He teaches courses in sportscasting and play-by-play, applied uses of social media in sports media, sports and society, and the intersection of academic theory and social media. Galen is a graduate of IU, and he worked for several years in the sports media field before returning to IU for his doctorate, which he earned in 2008. I give the microphone to Galen Clavio. Thank you.
Thank you, Joe. I appreciate it. And thanks to everybody who's been a part of this event from the beginning of the day all the way through now. One of the reasons why we wanted to do this event in the first place was how critical this particular topic is, both from a societal perspective and from a media perspective. And, we've been blessed, I think, to be able to work with such tremendous professionals across the board. I wanted to extend some thanks to all of the people that we've had involved. First and foremost, our partners at UNAM, who have been just wonderful to work with across the board in terms of coming up with ideas and figuring out exactly how we were going to approach these topics and what we were going to say. And being able to connect us here in the United States with your students at UNAM and allow for a real cross-cultural exchange of information. Tour playing place that I want to return to as soon as possible, because I found it to be just a fascinating and really welcoming place. The people were wonderful, and we're very fortunate to have our partners with the IU Mexico Gateway, including, of course, the director Molly Fisher, Lucero Guillen, who's been so helpful with all of these projects over the course of time. I'd also like to thank Joe Coleman, who you've heard from quite a bit throughout the course of the day. He's been instrumental in putting all of this together and helping to bring the experts from across the board in to talk about these issues and to bring as current a perspective as I think you could possibly find on these issues to you as we discuss them. So, as we think about what we've learned so far throughout the course of the day, to me, this is a shining example of what we can accomplish from an educational perspective when we bring different aspects and different disciplines together in the educational spectrum, cross over with journalism and the media industry, and bring all of our relative expertise together to be able to speak directly to students, be able to speak directly to people that have a vested interest from a political perspective, from a cultural perspective, from a humanistic perspective, in understanding the various issues that go on with what is a very complicated set of issues relating to immigration and the way that we report on it. So I look forward to many more of these sorts of collaborations as we move forward, and I'm looking forward to the media school here at Indiana University being a place where we can continue to do those things in partnership, hopefully with UNAM and with the IU Mexico Gateway. I hope you've all enjoyed the various panels that we've had so far today, and as Lucero just mentioned in the chat, there is a bag with event content that you can feel free to access as we try to say goodbye to you on this. A couple of other people that I wanted to thank before we signed off on things here at the media school, our dean, Jim Shanahan, who is always very supportive of these sorts of events, our director of the journalism unit, Jim Kelly, who helped to provide some of the financial support to make this possible, and also our media services group, which is headed up by Ann Kibler and Audrey Osterman, for helping to provide a lot of the media promotion and so forth that helped to make this a possibility. So again, thank you all for joining us today. I hope that this has been edifying for you, and I hope that you've learned some things. And we look forward to doing this again very soon. Muchas gracias, and thank you all.
El tema que abordo es el tema migratorio.
When Mexico sends its people, they're not sending their best.
I already started discussing these issues with the president of Mexico.
Se ofreció de que iba a haber esa reforma migratoria y no la llevaron a cabo.
They're sending people that have lots of problems.